It's been so exciting to listen to the science. So what I hope to do now for a few minutes is to change the way we're thinking about things and thinking more about the experience of being an ovarian cancer survivor from the moment of diagnosis and for the remainder of one's life, and also for the care partners and loved ones. I want to share with you some of the exciting work that we've been doing now at Stanford. Hopefully, if I have the pleasure of talking with you again, I will have more results of trials. But for right now, just some ideas about how we think about our response to living with cancer. We've been doing some exciting work in partnership with Dr. Ali Crumbs in psychology here at Stanford University. I'm a medical oncologist, so even though I'm going to talk about mental health, I am not an expert in mental health, except that I think that it's so important for people living with and the care partners. So let's think a little bit about mindsets. What are mindsets? Well, there are many variables that affect a person's experience, how they communicate and interact with a cancer team, for instance, and with their own family and how they cope. What is often overlooked are factors about the mindsets that people hold. Mindsets are those core assumptions about the nature and workings of things in the world, and are critical but relatively understudied variable that can influence mental as well as physical parameters and physical health in people living with cancer. Mindsets can help people organize, simplify, make sense of complex concepts and also of uncertain situations. Mindsets influence our attention, what we pay attention to. They influence our motivation, what makes us tick. They affect our physiology. There have been very interesting studies, not in cancer yet, but certainly in physiology, even in allergies, about the fact that how we think about something really influences our physiology in response to stimuli. And can also be, mindsets also can be self-fulfilling. They're not necessarily true or false, but they can be useful, and they can be more or less useful depending on the context. They help us understand what is possible. So two people can have the same type and stage of cancer, but may look at things very different and may be very different psychologically. One may look at cancer as a catastrophe, and this may trigger anxiety and depressive thoughts in another person with the same stage of cancer may view it perhaps as something that is manageable, even an opportunity. And an opportunity for what? For positive change. It doesn't mean that cancer is good, but how people look at it may influence so many things that really affect quality of life in all of their different dimensions, and even perhaps in their treatment. So let me tell you a little bit about what we're finding when we've started to do some work about mindsets and cancer, or mindsets about cancer. In the face of a cancer diagnosis, some people may assume that the mindset that cancer is a catastrophe. And this mindset, just like the cancer, can take hold, and it can also spread, and it can affect a person's view of treatment. And that person may find themselves stuck in a cycle of worry or frustration or rumination. They may give up activities that previously they enjoyed. They may be burdened by that uncertainty, not knowing what the future holds. And their attention is constantly drawn to what frustrates them. And that's thinking about this as a mindset. Mindsets as what we pay attention to, and then what motivates us. Now, given the same circumstances, a more adaptive mindset is one that perhaps that cancer is manageable, maybe even an opportunity. This mindset will affect also other aspects of a person's life and shift the attention and the perspective towards making meaning of the experience, finding opportunities for growth, a renewed appreciation for life, and perhaps even motivating some lifestyle changes, which can have good consequences. So viewing cancer as manageable or even as an opportunity doesn't mean that cancer is a good thing or that treatment is easy, but it does allow room for change that otherwise, if we are stuck in a mindset that is catastrophic, would not be possible. So that brings me to talking a little bit about what we're finding that people with cancer think about their body. Some people may think the body is working for them. So is my body working for me is the question. Or is it capable of handling the disease? Is it capable of handling the treatment? So that would be a positive growth mindset, but others may adopt a mindset that the body is an adversary and that their own cells have turned against them. They can imagine the consequences of that thinking, right? This shifts the attention towards physical symptoms and side effects. Basically, it leaves a person feeling that they may be incapable of handling these. They may need more reassurance. They may need more medication, and they may not feel very good about themselves, their body, or anything that's going on. They may be feeling more out of control. And as a clinician, I hear that and I see that a lot. This type of mindset that the body is not capable or even the body is an adversary may extend to periods of remission and may also impact how people feel sometimes overwhelmed. At times, for instance, when they need to have surveillance scans or blood tests, and it may increase a fear of cancer recurrence, which is such an important symptom and for many of the cancer survivors, and we see that a lot. So what I want you to think about are useful mindsets, mindsets that can help us think about the body, adopting a mindset that the body is capable, that it is naturally strong and naturally resilient, orients your thinking towards signals that the body is handling it well, that the treatment is handled by the body, hopefully working for you, and that you can tolerate those side effects of treatment. And it may motivate you to engage in physical activity. It may help you manage the anxiety that may surround some times or precede the visits to the cancer team. So as we're learning these things, and we've done some surveys and we've done some early work, we're also designing targeted interventions that target the mindset. So what we need to do is find ways of capturing people's attention through short film clips, through exercises, and then nudge them towards more adaptive growth, flexible mindsets. Mindsets can be changed, and we can adopt a mindset. We've just started to study this. In fact, we just did a randomized controlled clinical trial. We're analyzing the results that I have to share with you. Look amazing. We haven't quite published yet, so I can't share these with you today, but perhaps some other time. So just as more, this is what I want you to take home, just as more precise, targeted cancer treatments as you've heard about today are now available. Wise psychosocial interventions that target mindsets, including mindfulness trainings or short courses of cognitive behavioral therapy or psychoeducation, can also help. Mindsets can also be shaped through social modeling. So what we do, what each one of us do, can also influence the behavior and the way others can live through and beyond their experience and their diagnosis. So in the few remaining minutes, I'd like to talk about or touch briefly on two other things that are also important. And the second topic I want to talk with you about, which is so important to cancer survivors, is being well informed. I mean, this program today is about bringing you the experts and bringing you the novelty and bringing you the change so that you feel connected and you feel empowered. I want to acknowledge that most of us these days turn to the internet for information. In fact, a study done by the Health Information National Trends Survey in 2018 found that 70% of US adults have accessed health information online, with cancer being one of the most frequently searched health items online. And listening to our colleagues today really shows how powerful it can be to connect through conferences or perhaps informally in social media with people who really have a lot of knowledge or a lot of anecdotal experience that can help. But I want to warn you a little bit about fake medical news as well and medical misinformation. So health misinformation is simply false or inaccurate or misleading according to the best available at the time. And we know, all of us who are present here know just how quickly health information changes through research. So perhaps out-of-date information can be considered misinformation. So it's important to look for the credentials of the person who is posting or speaking, as well as when the presentation was made available. But as we think about that, and as we think about choosing wisely and choosing carefully where we access information or who we listen to, remember that when you sometimes see some fake news, especially fake medical news, there may be a kernel of reality. A lot of it has a base in reality, maybe based on a personal story or an anecdote, but may be exaggerated. Or there may be a media spin for some reason because somebody is invested in a certain product or a certain way of thinking. It may be eye-catching. Sometimes the results of a new study may be exaggerated. So we're always looking for things that give us hope, but it's important to understand that sometimes that positive spin or exaggeration may be misleading. There have been quite a few interesting, well-conducted studies of videos, for instance, that are posted on YouTube. And one study, for instance, looked at studies on prostate cancer, and they showed there was a negative correlation between scientific quality and viewer engagement. Let me say that again. Those that were of lowest scientific quality actually engaged more comments. So one has to be really careful. Just the number of people viewing or the extent and the dissemination doesn't necessarily mean that the information is actually credible and scientifically vetted. Misinformation often spreads through confirmation bias, something that we all need to be aware of. And that means that we prefer certain information. So we're going to look for stories, presentations that confirm what we think, and not look at things which perhaps may contradict our beliefs, but be careful. All of us need to be careful in areas where we're not experts. It's easier to know in the area that you're an expert professionally, or perhaps something that you've taken a lot of time to do careful research in, but sometimes it's tempting to follow somebody just because they have a lot of followers. But please beware, engage with the experts as you're doing today. Look for information on websites sponsored by serious advocacy groups, professional organizations. So for my last 2 minutes, just some practical tips on how to engage with cancer clinicians, thinking about what I've said to you about the mindset, thinking about the importance of having good information. I think it's really, really important from the beginning, from listening to Dr. Carlin's presentation about receiving genetic information. This may trigger lots of feelings of relief, feelings of guilt, feelings of sadness. It's very important to acknowledge that there's going to be an emotional component to receiving news, and the news is not always necessarily good. So sharing the news, taking time to absorb it, developing some good follow-up questions, and knowing one can go back to the expert to make sure that one has understood the information is important. And then for those of you who are living with disease and have contact with a cancer team, I sincerely hope that you plan, you prepare, you organize, you debrief, and you summarize after you've had important meetings or consultations, especially at transition points. One of the things that we're learning is in survivorship research is, the importance of feeling that you have a connection to the team. Some of you will tell me that your cancer clinicians are your forever clinicians and that you love them and know them. But other times you need to establish a relationship with a specialist or somebody who's only going to be with you for a short period of time. All of those touch points matter in coming across, with very clearly with your questions, taking the time to make sure that your clinicians know that you need some answers and point you to the right sources of information may be very helpful. And of course, having support, bringing somebody with you, and then perhaps debriefing with others whose counsel you depend on. Or value after the meeting is also very, very important. So use the electronic portals for communication, use the internet without fear, but be discerning. We're here, all of us who are experts in our fields are here for questions, to answer questions, to provide guidance. With fields where there's discoveries are happening all the time, it's also important to feel up to date. So knowing where your trusted sources are for receiving those updates may also provide some comfort and some control. With that, I'll end because I'm at my time, and I would welcome the opportunity to answer any questions. I hope this was helpful.